Hello and welcome to Health Live at Seniors Today. We are delighted to have here with us Dr. Sarada. Dr. Sarada is a senior consultant obstetrician and a gynecologist at the Yashoda Hospitals in Hyderabad. With over 2 decades of experience, she received her medical degree from the Kurnool Medical College and a postgraduate degree training from the Osmania University's Government Maternity Hospital, a DNB from St. Teresa's Hospital in Hyderabad, and a fellowship in laparoscopy from Kiel University in Germany. Dr. Sarada is also experienced in dealing with high-risk obstetric patients. She has performed numerous deliveries in women with complicated cases of SLE and other autoimmune disorders such as leukemia, ITP, and other hematological concerns. Her ability to work as a team with respective specialties makes her a team leader to take care of the treatment of high-risk pregnancies. She has won various awards, including the Rising Star of the Year in the Obstetrics and Gynecology in 2017 and the first prize for paper presentation at the Vizag State Conference in June 2011. Thank you for coming here, Dr. Sarada. How are you?
Good, Mr. Prathaman. Thank you. Given a very big introduction of me. Yeah,
well,
thank you.
It is a little short. First of all, a very happy Doctor's Day to you.
Thank you.
And to all doctors who we've featured over the last few years. Apart from being here, you all are doing a great service to mankind, and thank you very much to you here. And since you're here, one can't talk less about the service to Indian society, India, and world that doctors are doing right now. Doctor, we've had over perhaps 150 odd webinars, but we've never really dealt with the issue of post-menopausal concerns. And
Yes.
This is perhaps because we concern ourselves with senior citizens, and post-menopausal concerns come somewhere in between, a little before. But as I was speaking to some doctors in the recent past, and they said, concerns may start at the age of 45, 50, but they extend up to beyond 60, and which
Yes.
is what senior citizens are all about, and Seniors Today concerns itself about. So, as always, we have Dr. Sarada here. She will make a presentation. She'll speak to you about the concerns. And if you have any questions after watching the presentation, you can put them in the Q&A tab. In case you don't want your name to be revealed, we will not reveal your name. In fact, as perhaps it's a good idea to not reveal any name, because some people may be a little sensitive about giving out their names. Just remember that while we have Dr. Sarada here, it is always advisable to consult with a doctor, with a healthcare professional, have a clinical examination, etc. Yourself. There's nothing to repeat, nothing to replace that. We are, of course, making things easier for you. We are clarifying doubts, etc., which you can always do. Over to you, Dr. Sarada.
Thank you, Prathaman. So, welcome all the participants for today's lecture or the thing which is going on. See, any time of the session going on, you can stop me, ask me any doubts.
No, Doctor, we'll do that at the end. You can make your presentation, and then we will, because I will be moderating it, so we will not interrupt you in between. You can just go ahead and finish your presentation, and then we'll start.
Yeah. So today I thought I will I'll try to talk about menopause. So we all know menopause is cessation of periods. A woman will stop her periods. That's what we call it as a menopause. But why should a woman have a menopause? Why not a man? Man will never have an andropause or something like that. So why a woman should have menopause? Did you all ever think about this? It's because, this is because it's a nature's gift to women to help her from the morbidity and mortality of having a pregnancy. So just think that women never had a menopause. Then the women will go on giving birth. So giving birth at a particular age is okay because so many changes happen in our body during pregnancy. The heart rate increases, the blood pressure decreases, so many changes, the respiratory rate increases. So all these systems will compensate the pregnancy at a younger age. But as the women's age increases, the new things come up. They get hypertension, they get diabetes. So those changes will not help the pregnancy to happen in a normal way. So they end up with complications. So if the menopause doesn't happen and the women start having pregnancies even after 50 and 60, most of them will end up dying during their labor and childbirth. That is the reason that nature has gifted women with menopause. It's not a curse, it's definitely a gift to prevent women from the morbidity and mortality associated with childbirth. So, 1 second, I think. Sorry, 1 second.
Yeah, go ahead. Sorry.
Yeah. Somehow I'm not able to.
Can you?
Yeah.
You can see your presentation, doctor.
It's not coming.
We can see it. We can see it, doctor. Just click onto this.
Done. So I'm clicking it. It's not coming. Want to help me, Prama? Sorry.
Well, no worries, doctor. Technology is technology, and it will happen.
Just I have to share the screen.
It was working absolutely all right a minute back.
Yeah, 2 minutes.
No worries, we will get back to it. So, as we all know, those who have come in late, we've got Dr. Sarada here, who is a senior gynecologist and an obstetrician based in the Yashoda hospitals in Hyderabad. And she's here to talk about post-menopause concerns for senior women. Yeah, here you are there.
Yeah. So we all know women's life is menarche, pregnancy, and menopause. So we all know menarche is when the periods start, and the reproductive age is when the pregnancies come, and then this is menopause. Menopause where all the periods stop. So menopause is definitely a permanent cessation of menstruation. So the ovaries, the hormones which have been secreting all the hormones, they stop. So when do you call it a menopause? When see, it is we call it backwards, retrospectively. So if a woman doesn't have periods for 12 months, and that 12 months, not because of she's been taking some medicines or not for some other cause, and she just stopped her periods for 12 months. In 1 year, she doesn't have a period, then we call that woman has reached menopause. So that we cannot, there's no biological marker. That means we cannot diagnose it by any test. It is only a retrospective diagnosis. And you don't have to conduct any test routinely to diagnose when the woman is going into menopause. So actually, there's this staging system, like the women's age, we can, there is phases of life. we call that premenopause. Premenopause is reproductive age prior to menopause. Perimenopause, that means 3 to 5 years before and 1 year after menopause. So this is usually before 3 years before menopause and after menopause, where the ovaries slowly they are declining their function. They secrete less estrogen and they are slowly stopping their function. But this period is not a sudden, it's not a one-stop solution. It might take 3 to 5 years. So that slow stopping the whole period, we call it as perimenopause. And menopause transition is disturbed menstrual cycle. So the cycle length increases. Sometimes they get once in 6 months or maybe after 8 months. So this disturbed menstrual cycle starts in the menopausal transition. And post-menopause it's a span of time dating from the first final menstrual period. So FNBP, final menstrual period. And after that, 1 year after that, if the woman doesn't get any periods, we call that she's into menopause. Senescence is after 60 years. So after 60 years, the woman is now going into this aging phase of senescence. So there are different types of menopause. A natural menopause is a phase where every woman gets it. Sometimes they can have premature or early menopause. So what is the natural age of menopause? For our Indian women, they say it is 49 to 50 years is an average age of menopause. But if it is early, less than 35, sometimes less than 40, we call it premature. Premature is less than 35. Early menopause is less than 40 years. If a woman goes into menopause so early, we call that. And some women might get their ovaries and uterus removed. So surgical or induced menopause. So all these come under menopause. So what is this premature menopause? Should we be worried? So many of the women, we do see many of the women who have stopped their periods even before 40 years. So why do women stop periods so early? Many times it can be just because of the genes. The genetic makeup is like that the ovaries do function only till that time, and after 35 years they stop. It could be because of some, what should I say, some syndromes, part of syndrome, some chromosomal deficiencies. And what are the symptoms? So what happens if the woman goes into menopause? So there can be different vasomotor symptoms like hot flushes, night sweats, and changes in the regularity and flow of the menstrual cycles. There might be genitourinary symptoms like vaginal dryness, pain during sexual intercourse, and neurological problems like difficulty in sleeping, insomnia, changes in the mood, depression, anxiety, low libido, joint and muscle aches, and they slowly start losing memory. All these things might come slowly. So they might be having hot flashes. So most of the women do know about this word of hot flashes, and night sweats. So it happens that suddenly a surge of heat wave passes from the body, from head to toe, and suddenly they start sweating, irrespective of the temperature around. So that we call this as a hot flash. So many women think that this is not normal. So, and some women do exaggerate it, some women ignore it. So these things make the women very weak. They are, what should I say, their mood gets disturbed. They don't know what is happening to their body, why so much of heat is coming out, why so much of sweat is coming out. And there might be a weight gain. So menopause is a time when suddenly the weight around the abdomen, so there'll be a change in the body fat. So the fat, all the body fat goes and deposits around the tummy. So there is a sudden increase in tummy weight and the muscle mass goes down. So this is a very characteristic sign of transition into menopause. The woman is experiencing these night sweats and change in weight gain, change in the weight. So these are all diagnostic features of menopause. We all said it is 46 to 50 years, the natural age at natural menopause in India. And how do you diagnose menopause? So there are some lab tests. So we can do a blood test called as FSH. So FSH is a hormone secreted from the brain. So if that is high, so usually it should be around 5. The FSH levels are usually around 5. If it is more than 40, then we can say the woman has gone into menopause. So all these are retrospective diagnosis. We can't diagnose when the woman is going into menopause. So if the woman doesn't have periods and then you test FSH, then we say, yes, she has gone into menopause. And estradiol is a hormone which is secreted by the ovary. So this is less than 20. And AMH, all these hormones will be very less. That's how you diagnose menopause. So why are we worried? What happens if the woman goes into menopause? So if the women, the estrogen is a hormone which protects the women. So estrogen and progesterone are the hormones secreted by the ovary, and they are responsible for the menstrual cycles and the pregnancy part of the women. But they have many functions apart from just periods and pregnancy. So what do? The estrogens give a beautiful skin. So they support the collagen and they make the skin glow. And not just the connective tissues, they protect the bones. So bones of the women till they reach menopause are stronger. They don't get osteoporosis. Only after the women goes into menopause, the strength of the bones in the women starts to decline or decreases, and they get more osteoporosis. And estrogen protects heart and protects the brain against a stroke by increasing the good cholesterol. So many times you do a lipid profile for a wife and husband of the same age. So in spite of their same life habits, wife doesn't have LDL, which is bad cholesterol. The HDL will be high in the women. That's because estrogen protects the women against bad cholesterol. And it also protects against vaginal dryness. It protects the vaginal epithelium, the urinary bladder epithelium, so they don't become dry. So once women goes into menopause, all these good things are gone. Their bones start becoming weak. They get these hot flashes. They get the urogenital symptoms. So these are all the complications of going into menopause. So the arteries and all start becoming blocked. There'll be slow digestion and weight gain. So some women still get postmenopausal bleeding. So what is postmenopausal bleeding? If the woman gets a bleeding after 1 year of menopause, so that means the periods have stopped for 1 year and then she starts having bleeding. So should we worry about this postmenopausal bleeding? Yes, so we should worry about this because 1 in 10, that means 10 out of 100 might land up with a cancer. So the cancer can be in the ovary, cancer of the uterus, or cancer of the cervix. Any reproductive organ cancer can mimic with the postmenopausal bleeding. That doesn't mean that every woman with postmenopausal bleeding will have cancer. I said 1 in 10. So the 9 might not have, but 1 might still have a cancer. So we should test why she's bleeding, from where she's bleeding very thoroughly when she's having postmenopausal bleeding. And this is a time when we should get the health checks done properly. So as I told you, there is a risk of osteoporosis. So this is the time when we should first test our bone mineral density. So bone mineral density test is a simple test. It is done by a machine. So where we test how thick our bones are, how strong our bones are. So they check the bone mineral density in the spine, in the long bones, basically the shoulders and the thigh bones. So that tells us whether the woman is at risk of osteoporosis or are her bones okay enough to carry through the menopause and things like that. And the other health checks which are supposed to be done along with this are, we need to do a pap smear. So pap smear is something which everyone will ask me, how many times should we do it? So some do it every 6 months. Some don't do it at all. They are scared of something being kept inside. So pap smear is a very important test. We should to check if there is any malignancy in cancer in the cervix. Cervix is the lower part of the uterus. So we need to check that, and that has to be done once every 3 years. So the interval is every 3 years, and we have to do it till the age of 65. So till 65, if all the pap smears have been normal, after 65, we can stop doing a pap smear. This similarly, the bone mineral density, we have to do it every 3 years. So we have to, once we go into, the women goes into menopause, we have to do it. And then 3 to 5 years, we have to repeat the bone mineral density. And there's another test called as mammography. Yes, most of us now know about this mammography test. And after 40 years, every year, we should be getting the mammography done. And in ultrasound to check for the uterus and ovaries. So sometimes the uterus can be very thick, endometrium can be very thick, ovaries might have some cysts. So we should be doing the ultrasound. And other blood tests to check your cholesterol levels. Now that the estrogen is not there in the body, there is a risk that bad cholesterol might increase. So suddenly the women will have to start their anti-cholesterol medications and all once they go into menopause. So we have to check these things. And lifestyle changes are definitely needed for a woman who go into menopause. So many women do not understand that they have gone into menopause, and some women overthink about it. So the mood changes, the night sweats, they come in and they say that they're very troubled with these things. Yes, these are symptoms, these are a part of aging process, but when they are troubling you so much, you should definitely take help of the doctor. And simple changes, the lifestyle changes might help. So when you ask me about vasomotor symptoms, that hot flushes and all. So people say that a lot of yogasanas, especially Bhasrikas and pranayam helps with the hot flushes, and taking a lot of plant-based estrogens like soya, uh, the flax seeds, and all these will help against the hot flushes. So, and definitely exercise. So if you have not exercised throughout the life, that is another thing. But when you are into menopause and the menopause transition, you should exercise, especially the weight training exercises. So I tell all my patients that you should now hit your gyms, lift up your weights, so that resistance exercises strengthens up your muscles, keep your bones strong. Otherwise, slowly you will land up into osteoporosis. So what is osteoporosis? Suddenly the bones break. A small fall, which they're not supposed to break, they break. We do hear so many women, a small slip, a small skid, then they break their bones. That's because the bones are weak. So all these changes, we need to protect ourselves in this old age. So the old age is age where we have worked, most of us work through the all the ages of life to enjoy in that phase of life. So health is a thing which we need to protect, and definitely the exercise, lifting weights, keeping the bones stronger. And how else can we keep them stronger? Eat good food, calcium rich food. I don't recommend calcium supplements for everyone. Eat good calcium rich food. Don't smoke, don't take too much of alcohol, and get your screening test done. So health checks properly and proper exercise. So these lifestyle changes are definitely must when a woman goes into menopause. And apart from these lifestyle changes, there are a lot of hormonal changes also, hormonal medicines also which we can give. And for the osteoporosis, we can give some things to increase the strength of the bones. So we can give bisphosphonates. And initially HRT, hormone replacement therapy in menopause, was a big thing. So sometimes in 90s, every woman used to be there was a time when everyone used to get a prescription of hormone replacement therapy when they go into menopause. But then suddenly, the world started seeing more number of cases of blood clots. So blood clots and increased number of breast cancers. So they stopped giving hormone replacement therapy to all women who go into menopause. Only few women are indicated, and that too now a new form of hormone replacement therapies have come. The older medicines which used to give the problems have been recalled back, and the new ones which are not giving the problems, like not giving so much of clots in the brain, blood clots, not giving a risk of breast cancer, have been invented. And new methods, modalities are there which we can give for the relief of menopause symptoms. So some women do suffer very badly with hot flushes and sweats, especially those who have gone into surgical menopause. So suddenly the ovaries are removed, the woman goes into such a bad phase of hot flushes and menopause. Sudden cessation of those hormones give her a very bad time. So for them, definitely we can support her with a slow phase of hormones and withdraw them slowly so that she doesn't go into that sudden menopause. And osteoporosis is one indication where you definitely need hormone replacement therapy. So the women is at a very high risk. So who are at very high risk? Those who have a very sedentary lifestyle, those who are very thin. Even the lean women do have a high risk. Similarly, a very high weight woman, and those who have diabetes. And for they've been taking a lot of steroids. So some women have to be on steroids for some of their other medical problems. So these women are at risk of blood osteoporosis, the weak bones. So for them, we can put them for some time on hormone replacement therapies. But for some, those who already have clots, those who already have liver disease, high blood pressures, we cannot give the hormone replacement therapy for them. These are different types of HRT. I think we'll skip this. Thank you. I think we can now take the questions.
Thank you very much, Doctor. Thank you very much for a very detailed presentation. I'm not very sure how many questions we'll have after this, but be that as it may, we have one question which has come to me by WhatsApp. This is, Doctor, my mother is exceedingly embarrassed about urinary incontinence.
Yes.
This has happened after her menopause.
Yes.
Please tell us what we can do about it.
So that's in discussing that urinary symptoms do increase after menopause, but there are different types of incontinence. So one type is urge incontinence. That means as a woman is going to the washroom, she's not able to hold till the time she's going to washroom. She just pass 2-3 drops from her bed to the washroom, and then before going to the toilet, she passes the urine. We call it urge. She's not able to hold it. This other thing called as stress incontinence is whenever she's coughing, whenever there's increased pressure in the stomach, they are leaking urine. So these are different types of incontinence. Sometimes they can have both. So if she has urge incontinence, it's usually because of some infections in the urine to give these things. So we need to correct the infections, and sometimes the bladder can be very weak. So we need to give them some medicines to make the bladder slow down a bit. So many a times incontinence can be treated. But our women, they feel embarrassed to talk these things and don't come to the doctor to discuss these things.
Right, absolutely, Doctor. Doctor, we have a question from Mr. Ajoy Roy.
Okay.
Says that this is a question for his wife who's having recurrent UTI. After all tests, the reports are normal.
Okay.
What we would like to know is what can be the solution or any other further tests required?
Yes. So,
and of course, we wishes you a happy Doctor's Day.
Thank you. Thank you. So, see, many times we mistake that it is urine infection, but sometimes it's not urine. We have to do a urine culture to say if the woman has a urine infection. Sometimes it need not be a urine infection. Anything in the vagina, any burn, any discharge. The postmenopausal women also can have a vaginal discharge. Infection in the vagina can give burning. And we think all burning is urine infection only. So we need to first clarify whether she has a urine infection or a vaginal infection and treat it differently. So I can't answer what she has, and I can't give a one-stop treatment.
Right.
Yeah.
Thank you, Doctor. This is a question from Preeti Jain. At what age should one start pap smear?
Yes, so this is very good. When should a woman start having pap smears? So, irrespective of marriage, I've been very open, irrespective of marriage, once a girl starts having sexual activity, 3 years after starting sexual activity, the women should have a pap smear. So even if the girl is 18 years and she has started sexual activity at say 15 years, at 18 years, she has to start the pap smear.
All right. Thank you. Now, this is another question which is there. Doctor, this is not a question, but a suggestion. The way Indian society is, there are very few psychological counseling that is available. And what is a possible solution is for women who are going through menopause is to have psychiatric counseling available. Why is it that doctors are not encouraging that to happen for women? And through various forums, may not be official, may not be formal, but could be in housing complexes, etc. also, or Rotary clubs.
Yes. See, this is a very important thing which somebody has brought this up. Even in my OPD, in a day, I see some menopausal women. They themselves don't have an interest in coming out with these things. They want to just live with those things. And in our society, in our Indian culture, women is somebody who's a neglected part of the family. And that too, menopausal women are still more neglected. So I feel that is the way it is pushed back and nobody is interested in talking about those issues.
Right. Doctor, this is a question from an anonymous attendee who says overall healthy lifestyle, including weight training and good diet, has not helped to relieve almost constant sweating and extreme hot flushes. Is there anything one can do?
Yeah, so we can start with the plant-based estrogens. We can take a lot of soya in your diet, a lot of flax seeds. But if that also doesn't help, there are some medicines. We can go with some medicines to help with the night sweats.
Right.
As I suggested, some non-hormonal and hormonal medicines to decrease these things.
Doctor, you mentioned about pap smear.
Yes.
Started after 3 years of sexual activity.
Yes.
What about tests for breast cancer, ovarian cancer, etc.? At what age should one start it, and what should be the frequency?
Yeah. So every time when a screening test is being said that yes, this is a screening test, they do a lot of studies. The WHO does a lot of studies, and out of evidence only they'll tell that we have to do it like this. They give. So pap smear is that cervical cancer thing, and for the breast cancer, they say the girl should check for her own breast, or women should check for their breast immediately after the periods. So that is the time when the pain is not there in the breast, and they should check at least once in a year. And we should check if any lump is found, then we definitely go to the doctor. But otherwise, even without any lump, we should go for a mammogram only after the age of 40 years. So at the age of 40, we start doing a mammogram. And the ovarian cancer, we know only by an ultrasound. So we should be getting a scanning done. So for ultrasound, there is no specific test and no age recommendation because they could not fix a proper test for ovarian cancer. It is so wide. But still, post-menopausal women, when they do their ultrasound and any cyst or anything is seen in the ovary, then that is how we get to know about ovarian cancer.
Except, of course, you may need to do it earlier in case there's a history in the family, right?
I didn't get you, Mr.
In case there's a history in the family.
Yes, there's a history, definitely, yes.
Doctor, we have a question from Marjorie Fernandez. He says, I've had no problems with my sleep or any other problems for more than 10 years after menopause. Is it possible that my inability to remain asleep for more than 4 hours at a stretch, no matter when I go to bed at night from the age of 65 years, is due to post-menopausal factors?
I didn't get you, Prathaman. Can you repeat?
I'll just repeat the question again.
Yeah.
I've had no problems with my sleep or any other problems for more than 10 years after menopause. Is it possible that my inability to remain asleep for more than 4 hours at a stretch, no matter when I go to bed at night from the age of 65 years, is due to post-menopausal factors?
So now she's not able to sleep. So that is the thing.
For more than 4 hours.
Maybe no. More 4 hours at a stretch, yeah. See, this lack of sleep is one thing. We discussed that senescence is age which starts after 60. So that is one of the menopausal symptoms. Definitely, yes.
Doctor, there's a question which is, what are the side effects of hysterectomy?
Side effects of?
Of hysterectomy.
Of hysterectomy, yeah. So hysterectomy, see, sometimes the women has to go through it for some indication. There might be fibroids, it might be heavy bleeding. So after hysterectomy, uterus and ovary share a common blood supply. So the ovaries should function till at least 45 or 47 years for a woman to have a healthy life. Once the uterus is removed, the ovaries stop a bit early, then the woman goes into menopause early. Sometimes with the uterus, ovaries also are removed. Then they experience all these symptoms of menopause early. So what the women has to experience at age of 50, they experience it early at whatever age they had the surgery. So they put on weight. Weight gain will give more complications like diabetes, problem with their knee joints, hypertension, and blood cholesterol. So all these problems do come up.
Right. Doctor, we have a question from Geeta Naresh, and we have at least two other questions, similar questions.
Okay.
Geeta Naresh asks, please suggest some calcium-rich food. Uh, there's somebody else who said that doctor, you mentioned about uh, plant-based food. So should one just uh, switch to soya and various other forms of food after the age of 50? What would you recommend?
Yeah. So calcium rich foods, yes. So all the dairy products have calcium rich. Ragi, all the non-vegetarians can have their proper chicken, all the non-red meat and the non-red meat for their calcium sources. And if you ask me the plant-based estrogens, all the sesame seeds, the flax seeds, soya beans, soya, and lot of even the chicken they say have a lot of estrogen, and the beans, all the sprouts have a lot of estrogen.
Right. Doctor, we have a question from one of our regulars who says, I'm 72 and should we stop doing mammography at this age due to radiation? And she says, I had a hysterectomy done 20 years back. Is it normal to be experiencing mood swings and loss of bladder control after hysterectomy?
Mood swings, no. The bladder changes might happen after hysterectomy. Mammography we can stop now that at 72. At 70 we can stop.
Right. Doctor, this is a question which is not from a senior citizen, but since we are dealing with this issue and a lot of seniors have their children and grandchildren at that age. This is a question from a 40-year-old. What all menopausal precautions does one need to take as their periods have reduced to 2 days time span?
So this period disturbances are very, what should I say, unpredictable. So they might decrease, then they might, the increased frequency, once in 3 months, once in 4 months, that is a thing which is more indicative of menopause. This decreased period loss might not be because of menopause. It might be because of the weight gain and the hormone imbalance only. And what changes should be? Definitely again the diet, proper diet, a lot of exercise. Right. So the transition will be smooth.
Thanks, Doctor. Doctor, there is an unfair question to ask a practitioner like yourself, but there are two questions which have been asked. That is it good to take alternative medicine, especially Ayurvedic medicine, for alleviating problems of menopause? That's one. Yes. Second is, would you advise doing yoga for alleviating concerns about menopause, post-menopause?
So this alternative medicine, even they have the same things. So they're all estrogen based, be it homeopathy, be it Ayurvedic. They all get from the plant sources and they have the same estrogen. So there is no harm in taking any form of treatment. Once we get relieved of the symptoms, that is good. And yoga definitely helps. That is a, what should I say? Short thing. Yoga helps for hot flushes.
Yoga helps for hot flushes. Doctor has been very clear and very direct with all her responses. Thank you very much, Dr. Sarada, for this session today on post-menopause concerns. It has been very enlightening, and while I'm sure people will be watching it, and they'll be watching also the edited video of this and the takeaways. As always, the video of this session and the takeaways, which are written by a qualified medical practitioner, will be up on seniorstoday.in on Monday evening. So you can have a look at that. You can watch the video. You can specifically go through the presentation. Once again, you can share it with your friends and family who may not have been here, and take advantage of all the knowledge and advice of Dr. Sarada. Thank you very much, Dr. Sarada, for being here. Before you leave, Doctor, just a few small announcements. We'll be back once again next Saturday at 5 p.m. for another session of Health Live at Seniors Today with another doctor, another concern that people have for seniors. And tomorrow, that is July 2nd at 11 a.m., we'll be having the finale of season 11 of Seniors Have Talent. Okay, season 11 of Seniors Have Talent, and you have all 60 plussers who are going to be performing. 20 of them, 20 finalists, and they'll be all vying for the Singing Superstars Trophy. So that's there tomorrow morning at 11 o'clock. And I'm going to request our producer to put in a link so that you can attend it if you want, or share it with somebody. It's good fun. I've been attending it all these years and all these seasons. And it's always good fun to watch seniors perform. And of course, there are the usual programs which are there through the week. There are programs of yoga, there are programs of meditation, which are also there, and you can attend these as well. Thank you very much once again, Dr. Sarada, for being here. Thank you to the team at Yashoda Hospitals for facilitating this. And we would love to have people from across the country, from doctors from across the country to be here, not just from Mumbai and Delhi. We've had a doctor from Yashoda Hospitals in the past as well, but it's always good to have people from across, and also shows the great amount of medical professional talent that we have in this country. On this World Doctors Day, I think with that thought, I'm going to sign off. And thank you very much once again, Dr. Sarada, for being here. Thank you very much.